What's up, Pro+Kinetix family? This is Dr. Nima, physical therapist, back with another video. And this time, we're covering one of the many components of my favorite joint, which is the shoulder joint. So today, the topic that we're covering is shoulder impingement. And shoulder impingement is essentially this kind of all-encompassing term that really just talks about what's going on at the shoulder joint and the space in the shoulder joint. And a common complaint with shoulder impingement that we hear pretty often is every time I lift my arm, I feel a pinching pain at the top of my shoulder. So if this is you, keep listening. If it's not you, keep listening. This is space in the shoulder joint between the humerus or the arm bone and the acromion, which is an extension of the shoulder blade. So I'll highlight this here. This is their humerus, that upper arm bone. And here is the acromion, which if we look at the shoulder blade itself, you can see that it starts on the back of the rib cage and wraps around and has a couple extensions. One, which is this part, that's the acromion, and two, this part, coracoid process. So the acromion is part of the shoulder blade that connects to the clavicle, which is your collarbone, and makes up that AC joint. And so this space in between the acromion and the humerus, right here, is the subacromial space. So your humerus creates your glenohumeral joint, which is mainly known as your shoulder joint, where it connects the head of the humerus, right here, to the glenoid fossa, which is the cavity of the shoulder blade itself. And that articulation creates that shoulder joint. We'll get into the importance of this in just a second, but within this space, we have a lot of tendons, ligaments, and other structures that run through it. So it's very common that when clients mention pain localized to this region in the shoulder with any overhead motion, including reaching up into cabinets, brushing their hair, or lifting weights overhead, like with a shoulder press or an overhead snatch, they're likely pinching some of the structures in that area. So if I add some layers here, you guys can see, here's the deltoid. Let's peel away the deltoid, which is our big shoulder muscles that we see on those bodybuilder type people. And if we peel that back, we can see all of the tendinous attachments and structures in this shoulder area. So it's a very complex region, but mainly you have a muscle called the supraspinatus, and that muscle is one of the 4 rotator cuff muscles. So that supraspinatus runs just underneath that acromion coming from the back side of the shoulder blade here and attaches to the top part of that humerus or the upper arm bone. Now I'm going to add some layers of connective tissue so you can see what the joint capsule looks like, and we'll get into this later too. Okay, so there are a lot of reasons why this area can become painful and uncomfortable. So if we're keeping it simple, you have a spider web of ligaments that hug your shoulder joint. This makes up the joint capsule. This is important because it can get tight, and if it does, it will restrict the motion at the shoulder joint, causing pinching pain with any overhead movement of the arm. Another reason you can get pinching at the top of the shoulder is due to muscle imbalances. So in our first video, you remember the upper traps that was that muscle that ran from the neck out to the shoulder. If those muscles are tight and the delts, which I peeled back earlier, become super dominant with the movement, which is very typical, and you have weakness of the rotator cuff muscles, you could end up with some of these issues that we're talking about. So the rotator cuff essentially acts as a suction cup, which could be why it's mistakenly called the rotary cup. We hear that pretty often. And it stabilizes your shoulder joint. Weakness in that rotator cuff could cause a lack of stabilization throughout the shoulder joint, which then allows the more dominant muscles to do most of the work, causing an imbalance in the mechanics of the joint and eventually leading to that pinching, aggravating type of pain right through the front area of the shoulder here. So I'm just going to give you an example of what the supraspinatus does, which is that muscle that we highlighted right over here. And if we talk about some of the action, supraspinatus is an abductor, which brings your arm out to the side and above. So now if you picture this motion and picture that space that we were talking about earlier, we know that if that space has shrunk due to some of the things that we talked about before, every time you lift that arm up overhead, I'll pause it right here, you can see that you could easily pinch that area right up there. In that highlighted muscle through that space, the tendon could just rub along the bottom side of that acromion. And you can see it here again. So this tendon right here could rub up against the bottom side of this. So all of this is super important because that type of shoulder pain is very common and can be very irritating. It can affect the way you sleep or function throughout the day with things like mentioned earlier, reaching into cabinets, washing your hair, reaching behind your back, or with exercise and resistance training, making it difficult to perform overhead lifts or shoulder and chest workouts. Commonly, our clients mention pain with attempting push-ups, side raises, overhead presses, and many others. So at Pro+Kinetix, we will perform a full body diagnostic, including an extensive evaluation of the problematic area, manual therapy techniques to help relieve your symptoms, and then finally give you an exercise routine to help maintain that relief, improve your mobility, strengthen the weak rotator cuff muscles, and prevent that problem from returning. Thanks for tuning in, and catch us next time.